Since we're on the topic of the well-being of first responders and EMTs, I thought it was important to show you guys this PowerPoint. We actually use this in a PowerPoint for our full-time agencies and our continuing education classes, and it really outlines part of the process of what we see as first responders. So I thought it was important to take a few minutes, go over the Code Green campaign, and also talk about some of the statistics associated with our role as first responders, what we see out there, and how to deal with some of this stuff. So the Code Green campaign is a first responder-oriented mental health advocacy and educational organization. So really its goal is to help connect people and provide a list of resources. It helps raise awareness of first responder mental health issues on social media, and it tracks first responder suicides. And then lastly, it provides peer support groups. So mental health for first responders it's a pretty big deal. I mean, we see a lot of stuff as we'll continue to talk about and as we have talked about that people just don't deal with and see in their everyday lives. The rates of suicide, depression, post-traumatic stress disorder, anxiety, the increased use of substances and the abuse of these substances, all of these things are exponentially higher in public safety personnel. A lot of these people, and a lot of first responders, paramedics, whatever you have, use these things to try to cope with some of the trauma and the traumatic situations that they've been a part of and seen. The problem is that the stigma that it is attached to all of these things, such as depression, anxiety, things like that, it's not so much the depression and anxiety which is killing people, although it is. People aren't getting help because we're supposed to be the ones that are strong. We're supposed to be the ones that have everything together. And it's hard for us to admit when we need help. So the signs and symptoms may be there and people just may not be looking, and even there may be some cases of denial of these first responders that say, this isn't happening to me. It's just, I had a bad call, I'll brush it off, I'll go out, have a couple drinks with friends, and I'll be good. But it's important to know that no matter what you're going through, these things are recoverable, and it's possible to get over this stuff with the right help. So why does this happen to first responders and not necessarily other groups of people? It's not exclusive to just first responders, although we are a big part of this. But the thing that we see and the thing that we continue to discuss is we have a constant exposure to the stressors that cause depression, anxiety, PTSD, and things like that. Along with that, we've got the quote-unquote macho culture. In the firehouse, we're not supposed to be the weak ones. We're the ones that are going in and saving people and bringing people back to life through CPR or reversing overdoses and things like that. And a lot of people feel that if you're asking for help as it relates to anxiety, depression, mental illness, and things like that, that you are now not a strong person anymore, that you're among the weak. And then lastly, we've got an increased access to be able to commit and follow through with lethal means of suicides. Whether that's drug-induced, whether that's weapon-induced, whatever it may be, we've got access to be able to kind of do these things and so to speak, eliminate the problem. So the stigma that we're talking about is the excessive emphasis on honor, bravery, and being strong. Going into burning buildings, going into scenes and situations where it's just total chaos and, saving people, bringing people back to life, preventing them from getting worse, which all of these things are great. But the problem is that this overemphasis overshadows the fact that it's still okay to ask for help. If any of you guys have been on transport ambulances as a first responder or as a driver, or been on calls as a firefighter or anything like that, take a look back. Psych eval calls and behavioral health issues are a big part of who we transport. Think about the last patient that you transported for mental health issues or psych eval or anything like that. How were they discussed on your way back to the station? or back at the station? Were they made fun of? Were they talking about, oh, it's this person again, they can't seem to get this together, or, whatever else the case may be. But think about how you talked about them on your way back to the station or at the station, and then think about if you ask for help. The dark side of humor that we use to cope with is also the number one reason that we as first responders don't come forward and ask for help, because we don't want to be talked about the same way. So this creates the reluctance, from people suffering from something to ask for help. They don't want to lose respect. They don't want to lose their status. They don't want to lose their job with that stigma that says, oh, well, he's got depression or whatever else like that. He can't be a fireman anymore, can't be a paramedic anymore. And that's not necessarily the case. So let's talk about some statistics as it relates to this. 20% of all public safety professionals have some degree of depression. 35% of all public safety professionals have some degree of anxiety. 20% of all public safety professionals meet all of the criteria for PTSD. And 35% of all public safety professionals meet some form of the criteria for PTSD. So when you think about this, that's almost 55% between the two for PTSD, that you either meet all of the criteria or some of the criteria for PTSD. So half of us out there are meeting the criteria or have all of the criteria met for PTSD. That's a huge portion of the first responder population. And I use first responder as a global term. That includes police, fire, EMS, everybody is first responders. So let's talk about the last, well, not the last 4 years, but 4 years out of the last 5. Talk about 2012, 79 fire and EMS suicides, just below the actual number of line of duty deaths at 85. In 2013, there were 69 fire and EMS suicides and 107 line of duty deaths. 2014, 110 fire and EMS suicides, and it was actually greater than the line of duty deaths. In 2015, same thing, 116 suicides and 86 line of duty deaths. So we spend so much time training on how to take care of other people, how to be safe on the scene, doing things at the firehouse about how to attack fires and things like that. But how much time are we actually spending about taking care of our own people and taking care of our own people's depression, anxiety, mental illnesses, mental health? So it's something that's really worth looking into at a much greater level. So let's look at some warning signs. Sudden changes in mood, being late or missing work, increased alcohol use. If you know that people are making end-of-life plans when they're 30 years old, 40 years old, showing a huge disinterest in the future, don't care about planning, don't care about getting married, having kids, building a house, going on vacation, anything like that. It's just living in the moment and not really caring about what the future may hold. So some risk factors that we should be concerned about and keeping an eye out as it relates to suicide. Have they had a history of attempts? Do they have a history of violence? Exposure to someone else's death by suicide, a coworker, a friend, a family member. Do they have the available means to carry out a plan? Do they have firearms? Do they have weapons of any sort? Do they have high doses of narcotic medication that they would be able to overdose on? Are they frequently intoxicated? And all of these can also be passed on to our patients, but we also want to take a look at our friends and family and coworkers to see if these signs and symptoms are present for them as well. So how do we start coping? Resilience is the process of adapting well in the face of adversity, trauma, tragedy, threats, or other significant sources of stress. So it means that we bounce back from difficult experiences. Over time, this is a skill that can be learned, but initially this can be pretty tough to handle. So don't beat yourself up over it. Don't dwell on that it was your fault when it wasn't your fault. that you should have responded earlier when you couldn't have responded earlier. To a point, you have to be able to brush some of this stuff off. You can't take every serious call personally. You need to have caring and supportive relationships with both within the public safety community and outside of, in your own personal life. Have confidence in yourself. By the end of this course, you'll be a trained EMT student ready for licensure, and you'll be trained well. So have confidence in your skills and know that you've done all that you can do and that you did all of your skills right. Accept that change is a part of life. Just being in EMS or medicine in general, change is always a part of life. Have goals. Keep things in perspective. And do your best to take care of yourself physically. Stress is a normal evolutionary response and prepares the organism to deal with the environment. The social support structure of the fire service is protective. We're all one big family, and we're quite resilient. However, we need to make sure that our social support comes first from our families and our friends, and then our coworkers. So here's some statistics about seeking help. The majority of firefighters would seek professional support from clergy, almost 41% over professional counselors. That's just at about 7.5%. So why do you suppose this is? Let's go back to stigma. Let's talk about that when you go seek professional support from clergy or pastor, priest, whatever it may be, it's not as stigmatic as seeking a professional counselor. You think about the two, and while they may not be able to offer completely the same thing, they'd rather go talk to somebody religiously based than have the stigma of going to a counselor. And I find this next one very interesting. Despite continued exposure to traumatic events, firefighters and EMTs tend to still have positive views about the world, which goes back to being resilient. It doesn't necessarily mean that bad things don't happen to good people, okay, but we know that situations are beyond our control. Post-traumatic stress is a normal reaction in a normal person to an abnormal event. Okay, so don't think that post-traumatic stress and post-traumatic stress disorder means that something is wrong with you. Okay, it just means that whatever you saw bothers you. So this is a pathological and disabling variant of a normal stress reaction. It has very clear criteria, and the symptoms must be over 30 days, and it has to be an impairing function. Okay, so this doesn't mean that a call just bothered you and you kind of think about it when you sleep or something like that, and then eventually it goes away after a couple weeks or something. This is constant, and it impairs your ability to function. You can't get out of bed in the morning because of this disabling variant. You can't go to work because every time you walk in the doors, you just lose the ability to function because you don't want to relive that incident. So is everyone who experiences a traumatic stress suffering from the disorder known as PTSD or post-traumatic stress disorder? No, they're not. We can just have various forms of it. So let's talk about some things to prevent stress. Well-run incidents. When you've got a clear incident commander and they are very well at leading their personnel, there's a better chance that it won't be a stressful call. Even if it is a quote-unquote bad call, it may not be as stressful because everything runs so smoothly. Well-managed organizations do the same thing. They also prepare you and help you as well to deal with those stressors. Well-prepared providers. Okay? Do we know what we're getting into? Do we know the potential for what we can see? Are we confident in our skills? If we're confident in our skills and know what we're doing, we know that there was nothing else that we could have done. Well-conditioned personnel. Have you been around these things before? Do you know what it's like to experience this before? And how well-grounded is your life? Do you have a steady circle of good friends, family, kids, loved ones that can take care of you and talk through these things with you? Firefighters and EMTs are resilient. We've talked about that several times. And we use a lot of techniques that promote resiliency. And you need to recognize that people are going to cope differently. Some people stay quiet. Some people talk about it. Some people joke about it. It's important that we let those providers maintain as much control over their stress response as possible so that they can deal with it in their own way. But once we start seeing those signs that things are going south, we need to make sure that we're there to help. A critical incident is a stressful event that holds the potential to overwhelm one's usual coping mechanisms, potentially resulting in psychological distress and possible impairment of normal adaptive functioning. Here's kind of a funny skit about a critical incident stress debriefing, but it is true. People tend to build a wall around themselves because they don't want to talk about it. It's important that we make sure that we're not forcing them to talk about something. So critical incident debriefing is used to mitigate the stress among emergency responders. There's a couple different types. There's CISD, or critical incident stress debriefing, or psychological debriefing, which is a modified form of critical incident stress debriefing. This is a facilitator-led approach, and it enables participants to be able to go over and review the facts, talk about their thoughts, their impressions of what happened, and the reactions after the incident is over. The goal of this is to try to reduce the stress and facilitate and accelerate the recovery process after this traumatic event's taken place. The problem is that a single session usually and may not be adequate for certain situations or certain people types, so you may need more follow-up. The military used this in its originating form. The account individuals gave on return from a mission as a debrief. So the information was analyzed, they used it to strategize for any other future missions and exercises, so they purely used this as an educational and operational debriefing. An aided process to be able to reduce the psychological damage of a traumatic event as well. So what is critical incident stress debriefing or management? It was originally developed to allow emergency personnel to be able to openly discuss their feelings with their peers and with mental health personnel following the exposure to some sort of critical incident. The international consensus statements, they said, because of the possible negative effects, it is not advised to organize forms of single session debriefing that pushes or forces people to share personal experiences beyond what they would normally share. So the biggest thing we want to talk about here, first and foremost, is confidentiality. But we do want to foster discussion that's a non-threatening in fashion. We don't want to make it so that it's mandatory. We don't want to make it that it's mandatory to participate and speak. But we do want to capture and leverage those golden moments or those aha moments to help facilitate that healing process. And it may not be just for you, it may be for others that are in the room with you as well. So we seek similar real-world experiences and talk about these things, and then we help apply that experience to a real-world practice. But again, confidentiality, what happens in that room should stay in that room. Psychological first aid. So we want to make sure that we're listening, and we want to convey compassion. So not only listen, but talk about and empathize with that person as well. Assess their needs, ensuring that basic physical needs are met. Okay, are they not eating? Okay, let's take care of that. Let's figure out how we can get them to eat. Not forcing a person to talk, but being there and listening when they do want to talk. Maybe it's a month or two before they want to talk about it, but be there when they're ready. Providing or mobilizing company from family, significant others. Okay, make sure that they've got a good support system in place. Encouraging but not forcing social support. So make sure they know it's out there. Make sure that, hey, you want to go out and grab dinner. You want to go out and watch a movie. You want to go to a game. But don't force them to do stuff with people that they don't want to do. And make sure that we're doing our best to protect them from any sort of additional harm. So the processes for requesting a critical incident stress debriefing or other mental health resources for any agencies in McLean and DeWitt County. You can contact Champaign County Dispatch at the number posted there. Ask for the regional team to be paged. They'll take your information and they'll call you back. If you're in Tazewell County or Woodford County, you can contact OSF St. Francis in Peoria. Ask for the critical incident stress debriefing team to be paged. Again, they'll take your information and they'll call you back. If you're from the Putnam County area, go ahead and contact our EMS office and we'll work on getting the arrangements. And as always, if you have any questions, feel free to ask. Ask for help, ask for assistance, and if we can't help you, we'll get you in touch with somebody that will.